Hello, my name is Amy Lamoureux Hesbach. I'm a physical therapist and canine rehabilitation professional. I'd like to take the time to talk to you about preparing for your pet's orthopedic surgery and also give you a little introduction to physical therapy and rehabilitation and how that can benefit you and your pet during this post-operative time. First, when we talk about preparing for orthopedic surgery, as a physical therapist, am talking about preparing not only your pet, but also your home, as well as yourself, your family, and friends. By preparing your pet, above all, we want to manage your pet's pain. We want to make them as comfortable as possible. So, this requires us to coordinate and collaborate with our veterinary medical team. We want to restrict activity to ensure that our pet is not additionally injured during this preoperative period, and to assure that they are aware of their capabilities and restrictions throughout that postoperative period of time. It'll make your life much, much easier if you keep them somewhat restricted. We want to prepare a safe room, and we'll get into a little more detail about what a safe room is. We might want to perform a fashion show by trying on these different devices, harnesses, collars, etc., with our pet prior to surgery to assure that we can get them on and off safely and easily, and that our pet is tolerating them within the home. You may want to schedule a preoperative rehab session. So, a physical therapy and rehab session prior to surgery to further prepare yourself and your pet. And as you do that, you may want to start practicing those physical therapy and rehab techniques that you're taught in this prehab session. By preparing your home, this requires a little bit of maneuvering of furniture. You're going to block off some stairs and furniture. You might close doors to rooms to reduce access of your pet to places where he might be unsupervised or unsafe. You want to provide a safe space in which your pet can maintain social and mental stimulation, but also activity restriction. So a great space might be within the kitchen or within the living room, one of the gathering areas of their home, with quick access to outdoors, but yet with less stimulation so that they're not running about and getting into trouble by having free access to the rest of the home. You want to consider non-skid flooring surfaces, and we'll get into a little more detail on that. Allow for safe access to a sleeping area, a feeding and watering area, and a potty area. And you're going to minimize stimulation and distraction. So one way to do that might be to put a sign on your door or near your doorbell, allowing and notifying neighbors, delivery people, mail people, not to ring the bell, knock on the door, etc., to not distract or further stimulate your pet. When I do a prehab session with my clients, I do tend to use a home safety checklist where we go from room to room, look at the entry and exit of the home to assure that the pet is going to be safe within the home in that postoperative period. We help to construct a safe room or a safe space for the pet. And this image borrowed from the internet is a fantastic one in which we have non-skid surfaces. So maybe rugs, maybe yoga mats, maybe rubber matting, maybe carpeting. We have beds and cushions, additional blankets and towels. We have food and water nearby, a very safe and quick path to the outdoors, minimizing the number of stairs that the pet needs to climb. And we might rearrange furniture or add a kennel, a closed door, a fence, barricade, or corral to enclose this space. So this should be a space in which your pet can get up. They can maneuver themselves around to get to their food and water, but not such a large area in which they can take a walk or run or jump, or get themselves into further trouble. By preparing yourself, this is not just the financial preparation and marking the days on your calendar, but thinking about the jobs that need to be done post-operatively. So who's going to babysit? Who will be with your pet in the first few days after surgery, if not within those first week or two? Who will give medications and food and water? Who will clean things up when things are a mess? Where will you sleep? How will you monitor the pet at night, to keep them out of trouble? Now, preparing yourself as well is to minimize your stress and anxiety. And so being 24/7 with your pet and hovering over them, if that produces more stress and anxiety for you, then maybe we need to do shifts with other family members and, allow you to have some rest as well. When doing prehab or preoperative physical therapy and rehabilitation, we do find that we have the potential for better outcomes. We have the potential for a faster or more complete recovery from surgery. We do know that as a pet owner, we have more control, we have less anxiety, we have a better understanding of what is to happen in that post-op period of time. The activities that we perform preoperatively are very similar to those postoperatively. This is a visit in which many questions are asked and answered, and we're really setting the stage for success postoperatively. Many owners will ask, how do I keep my pet out of trouble, both preoperatively and postoperatively? I think the key to this is definitely following doctor's orders. The second is to ask questions. So ask questions, many questions during that preoperative session with the surgeon, in phone calls and emails to the staff, with the physical therapy and rehab professional. By following doctor's orders, you're going to give medications and you want to give them as prescribed. So as frequently, as high a dose as is prescribed, not altering that without the permission of your veterinarian. If you see side effects, if there are some concerns, certainly you want to reach out to them. If they're not available, there should be an emergency contact available to you. By providing a safe environment and safe confinement, as well as some type of environmental or social mental stimulation for your pet, you're going to keep them out of trouble. So if they're mentally stimulated, like with puzzles and games and things that don't require them to be physically active, that stimulation will potentially keep them out of trouble. They'll be less likely to lick at their wound. They'll be less likely to injure themselves by being too active or too excited. So stimulating them mentally can be a great way to encourage their recovery in a safe way. You can also perform the home physical therapy and rehabilitation activities. This is going to keep your pet out of trouble. It's going to ensure a better outcome. And certainly, if you need help with this, reach out to a professional physical therapist or rehab professional. So what is physical therapy and rehabilitation? With regards to canine rehabilitation, it's very similar to that in human rehabilitation. Um, we don't have a formalized education. We do have professionals who are veterinarians, who are veterinary nurses, and physical therapists who have gone on to further specialize in animal rehabilitation and canine rehabilitation. But we all utilize very specialized treatments. We might use therapeutic exercises, manual therapies, other techniques to facilitate or to help those patients regain their lost physical abilities, strength, flexibility, and range of motion. We do find that physical therapy and rehabilitation is helpful for human and animal patients who have arthritis, who have had joint replacement, who've had sports injuries and back pain, also for physical or for injury prevention and for strength and conditioning and return to activity and sport. So, because we don't have a formalized education in canine or animal physical therapy and rehabilitation, I do invite you to ask and to look further into the credentials of the person providing these services to you. So, again, this might be someone with a license, a physical therapist, a veterinary nurse, or a technician. They should have some type of certification. There is an alphabet soup full of certifications. You can see all these seals and logos and such of certifications that are recognized and some that are less recognized. You should base your choice on the recommendations of friends and family and your veterinarian, and understand that there's a difference between a clinician or a professional who uses tools and toys and bells and whistles, and that who uses their knowledge and skills and experience to help with rehabilitation. Physical therapy and rehabilitation doesn't have to be fancy, but it is a process, and it is certainly scientifically focused, and focused on the evidence. So it's not something we make up as we go along, but decisions are made based on your pet's abilities, on your goals, on the procedure that was performed, and really on the capabilities and expected capabilities of your pet postoperatively. So, what should you expect with physical therapy and rehabilitation? Physical therapy and rehab can be either in the home or it can be in the clinic. There are benefits to both, and there are drawbacks to both. In home, it's really convenient for you as an owner. Likely the pet is going to be less anxious. It's easy to apply techniques in the real world because this is the pet's real world. It potentially could be safer, especially in the early stages of rehabilitation, because you don't have to get your pet in and out of the car. You don't have to transport them in the car. You don't have to lead them in and out of a facility in which they might have previous experience and be a bit stressed or anxious. And really we can apply a lot of the same techniques in the home as we could in the clinic. Another benefit is that there's more one-on-one. You get your questions answered. You're not getting rushed out the door. You're getting the time that you and your pet need in this precarious postoperative time. Whereas in the clinic, we do get that one-on-one experience, but we may find that there's more bells and whistles, more tools and toys, more distractions, different smells and sounds and experiences. Water therapy additionally is an option in the clinic, but really we have a very similar experience for the pet. And this may be great for some who need to get out and about and who enjoy that time in the vehicle to get to a clinic, enjoy that socialization, and may not be the best for others. So physical therapy and rehab certainly should include some type of manual therapy. So the therapist, the rehab professional is putting hands on, might be doing passive range of motion or stretching techniques, might be doing more soft tissue techniques, so myofascial techniques and massage and soft tissue mobilization, but might also be doing some mobilization and manipulation of joints and of the spine. Therapeutic exercise is key to rehabilitation. So getting the pet moving on their own, so under their own strength. Exercises tend to be more playful. They tend to relate to the functional activities that the pet needs to do, and exercises should be fun and not forced. So it should be beneficial to your pet. They should be easy for you to implement with some modification at home. We also use what's called photobiomodulation or laser therapy. This might be class 3 or class 4 laser therapy. And what we find is that this light, especially infrared light, stimulates the cell membrane, stimulates the mitochondria with specific wavelengths at specific frequencies and specific doses to help to improve the healing process. So bringing more energy to the cell, providing oxygen, providing pain relief, and stimulating the healing process by stimulating the metabolism of the cell. It doesn't seem like there's a lot going on there when we're using this laser light, but the proof is in the pudding, and we really can see some amazing changes and benefits to the pet as they're healing from surgery or from injury. So water therapy, talk about bells and whistles, it's a lot of fun. We have underwater treadmills, we have pools, we have all these fun machines and things for our pets post-operatively in the rehab setting. Is it really necessary? No. There are times in which it's beneficial. There are times in which it's detrimental. We use water to enhance range of motion and as resistance and conditioning, but many times we can accomplish the same things similarly, either at home or in the rehab clinic without water. So if your pet's not a water dog, if they're not enthusiastic about doing water therapy, all is not lost. There are lots of things that we can do in physical therapy and rehab to benefit them and to benefit you. So maybe water therapy isn't necessary, but it sure can be fun. So seeing your pet performing, walking on a treadmill in the water, or swimming, especially if we can see them through windows and underwater cameras and things. It's really fascinating and amazing to see this type of exercise and activity and how it can benefit our pets. So this all leads to, our expectations and outcomes, our goals of physical therapy and rehabilitation. So our overall goal in physical therapy and rehab is to say goodbye, is to graduate the patient, is to not need physical therapy and rehab any longer, is to see the tissues through the healing process, is to see the restoration of function, the return of the pet to activities that they love, including sports, including walking and hiking, including jumping up on the couch, whatever that might be. So early on, we really just want to see the ability of the pet to get up and to maneuver under their own power. We start leash walking, we advance to stair climbing, and then more later on down the road, maybe 3 to 6 months later, allowing off-leash activities and off-leash play, and then finally return to sport and return to life at closer to a year. Now, this coordinates with the pet's strength and abilities, as well as the healing process of the body, and can be very specific, dependent upon the specific injury and the specific surgery that's performed. Our overall outcomes, we want a happy, healthy pet. We want to restore that pet to as best an ability as they might have, maybe even better than they were before surgery. All right, so I hope you enjoyed just kind of a brief introduction to physical therapy and rehabilitation, and an introduction to that preparation for orthopedic surgery. If you have any other questions, please feel free to reach out to me, email, all kinds of social media and internet kind of crazy things. I also do provide a Kickstart program, which is an introduction to the first 2 weeks of rehabilitation after cruciate surgery, so after knee surgery for pets. If you're interested, feel free to scan that QR code, and I'll see you online. Have a fabulous day, and best of luck.